body will be relaxed, but you should not bend like this. You should be erect. Your spine should be as if there is a very straight rod going through your brain and coming out of your place where you're touching your chair or your floor. If you are sitting on a floor, sitting on a chair, sitting on a Padmasan or Vajrasan or Sukhasan, whichever way you are sitting, your back should always be straight. So that is one important prerequisite. So these are few things. And then while practicing pranayam, we will use both the nostrils, one after another. So we inhale through one nostril and exhale to the opposite nostril. And after exhaling, we will inhale through the same nostril and we exhale through the opposite nostril. So these are few things. And then we practice pranayam with different ratios. So whenever we do like just like that, if you inhale, hold and exhale, it will not be pranayam. There should need to be a fixed ratio. So when we teach our patients, particularly patients with some degenerative diseases and some problems inside the some ailments, we want regeneration to happen fast. So we teach them, initially we start with 1:2:1 ratio. While you inhale, you count a certain whatever is your capacity, you will count, and then you hold the breath for double the quantity of double the count of your inhale. For example, while you are breathing in, you are counting 5. Then you hold the breath and count 10. Then after counting 10, you exhale and count 5. And again you count 5 while you are inhaling, hold the breath and count 10, and exhale, count 5. As simple as it is. So it's like 1:2:1 ratio. 5, 10, 5. Inhale 5, holding the breath is 10, exhaling is 5. Simple, very simple. Don't need a guru or some trainer to teach this particular thing, because it is very simple. Even if you do a little small mistake, that is okay in this particular ratio. So 5, 10, 5. And while you're counting 5, you should not count like should not count very fastly 1, 2, 3, 4, 5 like that. It's like almost like seconds. 1, 2, 3, 4, 5. Or we can count like this. I count like this: Om 1, Om 2, Om 3, Om 4, Om 5, like that continuously. So that will give enough gap between two counts. So this is the way you count. And another important thing is, after sitting in a straight posture, your left hand, this is called chin mudra. Left hand, you put your left hand on your left leg. You take your left hand and you put it on your left leg like this. Then your right hand, you fold your index finger and middle finger. Index finger and middle finger, you fold like this, and you use these two fingers to hold your nose. So for example, you will take your right thumb and close your right nostril like this, and the other two fingers you can use them to close the left nostril like this. Okay, so you can use like this. If you can't fold them, you can just do like this also. This is a better way. It is called Vishnu Mudra. You fold your index finger and middle finger, and you use these fingers to hold like this. Okay, so these are a few simple instructions. Before I show you how to do pranayam, till now whatever I have told, you have any doubts, you can just ask me, so that I can go forward and show you the practical way of doing pranayam in the traditional ancient way.
Gee, thank you, Bhaiya. Well, I could see a few mics unmuted earlier, yet one hand risen. Ratikanta ji.
Okay. Hello, sir.
Hello. Yes.
Ratikanta ji, you may unmute again, please. You're muted.
Okay, am I audible now?
Yes,
you
you're
are.
audible.
Okay, sir. Sir, actually, I think 5 to 6 years back, actually, I have heard about this pranayama and yoga. So I went through some books and I tried. Okay. So after trying for 1 month, I feel the coldness in my body it is increases. So I
Mhm.
thought I did any mistake why I was not a continuous suffering of cold. But after the pranayam, I feel I think after pranayam I may did some mistake or something, so that I'm suffering of cold. And after that, I left this practice.
Okay.
So I want to know: is it related to pranayam, or are there any other situation which made me the cold fever? Yeah, other things.
Yeah.
Just
Generally, the right practice of pranayam will never cause any kind of side effects or aggravate any already or any symptoms which are already there.
okay, sir.
So it can be any other reason, but
Okay, sir. Okay.
because of pranayam, generally we don't get any side effects unless it is a very advanced pranayam and you are not doing it in the right way. Unless it is that case, I can say confidently that pranayam will not cause any side effects, visible side
Uh,
effects.
Sir, actually, I did that joke, the pranayam that you explained now, Olam, Bilam, and other things.
Mhm.
For one time, I did it for 100 numbers, yeah, 200 numbers. So I think is it a rigorous process, or I started with a large numbers of breathing. Is it routine
Yeah,
initially?
yeah. Initially, anyway, anytime you start doing any practice, whether it is a physical activity or breathing exercise or anything, we can start with very, very small steps, baby steps, and slowly, once you get mastery over the craft, you can increase and stretch your limits. Let us not start with I have whatever I have told till now. Right now, it's a very, very basic one. So once
Yes,
we
sir.
start with this basic one and slowly increase according to our own capacity, I'll tell you how to increase also right away. Right now, I'll tell you. So this way which I am telling you right now is a very safe practice, and you will not get any kind of side effects. That is assured.
Okay, okay. Thank you, sir. So I have another question. Can I ask?
Yeah, yeah. Please go ahead.
Okay, sir. Sir, during pranayam, whatever you explained, actually, you have explained in a more scientifically way. Earlier that we have heard or we have seen, they just told you take breath, you inhale breath, you exhale breath, and other things. And I have never heard. But today I'm happy to know actually what is the science behind this.
Yes.
Uh, so regarding this, I have another question. When we are taking oxygen, okay, so it is controlling our blood flows and it activate all the cells inside our body. Am I right?
Actually, is oxygen. In tradition we call it as pranavayu, and oxygen actually flows. It gets carried to each and every cell of the body through blood. Once it
Okay.
enters the lungs, from the lungs it gets dissolved in blood,
Yes,
and
sir.
then heart pumps that oxygenated blood to all the organs of the body, each and every cell of the body. So this blood reaches each and every cell of the body. There the gaseous exchange takes place.
Yes, sir.
Oxygen
Yes, sir.
reaches each and every cell, and
Yes, sir.
there this oxygen will be utilized to produce energy,
Yes,
and the
sir.
same oxygen also will also be utilized to build the tissues, regenerate,
Yes.
repair. All these things will happen with the help of oxygen. All the chemical reactions which take place in our body, they need oxygen, and if oxygen is not there, then all these reactions will become anaerobic reactions, and lots of toxins will be released if sufficient oxygen is not there while these reactions are happening. Okay.
Okay. Okay. Thank you, sir. Just another question is related to this question.
Mhm.
Sir, the during physiotherapy, whatever I have heard, they activate your knobs. If is there any problems, they activate just by pressing that positions. Okay. So I want to know whether the physiotherapy concept is it related to the nerve strength which can be enhanced by giving sufficient of oxygen to the nerves?
See, physiotherapy is more of strengthening the muscles and stimulating the nerves. Stimulating of nerves happens with various, electrical instruments and other things. Okay,
Yes, sir.
and strengthening the muscles happens with some exercises and all. So, whenever you are doing this, whenever there is a kind of activity inside your muscle, you need a lot of oxygen. Normally,
Okay,
when you
sir.
go to a gym and do exercise, or
Yes,
you are
sir.
running, or you are walking, or you are climbing
Yes, yes, sir.
stairs, you are doing a lot of physical activity and energy is being produced. Glucose is being burned and
Yes,
muscles
sir.
are very active. And that particular point of time, you need a lot of oxygen. Without
Yes, sir.
oxygen in the muscles, we will produce more lactic acid, which is harmful to the muscles. Muscle become very
Yes.
rigid over a period of time if lots and lots of lactic acid gets produced. And this happens if you don't take sufficient oxygen. So whether you are taking physiotherapy or doing some exercise or whatever you are doing, it's very important for us to have sufficient long breathing. Even if you are,
Yes,
while you're doing pull-ups or push-ups or running, it's very important for us to have open our lungs and do a lot of breathing while doing all these things. It's very important.
okay. 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 Thank you, sir. Thank you
Yeah.
very much. Okay.
So yes.
There's one more hand risen. Akash Kumar ji. Akash Kumar. Maybe I'm not really audible, but I can hand over the mic to one more hand risen. Professor Rashmi.
Yes, am I audible, sir?
Yes, madam, you are
Sir,
audible.
I just wanted to ask, even I have some practice of Ayurveda. I'm not, I'm just learning from you also many things. But I wanted to know, do we have a painkillers in Ayurveda? Because due to chikungunya, some patients are there and there are more chikungunya patients nowadays in Mumbai. And they just dying by the pains, joint pains that they do have. And by giving the remedies also, they are saying, madam, we wanted a painkiller for this. So do we have any painkiller as such in Ayurveda?
No, I would like to tell you that most of the Ayurveda practice, we deal with pains only. Back pain, neck pain, knee joint pains in multiple joints with people suffering with chikungunya or rheumatoid arthritis or so many conditions where the pain is the main symptom. And we handle pain day in and day out. Handling pain, managing pain, bringing down pain is our bread and butter. Okay, so we have n number of medicines which act as painkillers, but the action mode of action differs from the regular painkiller, which what we take in allopathic this thing, where we block the nerve signals from the part where the signal is coming, where the part is experiencing some kind of damage. It sends a signal to the brain telling it that I am getting damaged, and that will be revealed to us in the form of pain. So that will be blocked in various ways when you take painkillers, actual painkillers. But Ayurveda pain, the way in which we reduce the pain is different. Like there are several medicines which will relax the muscles, put the decrease the pressure of certain parts on the nerves. And there are other medicines which will reduce the swelling, inflammation, and by doing all these things they reduce pain. So there are so many, I can say thousands of medicines which will act as painkillers in Ayurveda.
Especially for chikungunya, when we have a joint pains, what painkiller we should go for?
No, it's not like a specific medicine for chikungunya pain. Okay, so there are so many painkillers, as I've told you. It depends upon their constitution, their condition, and so many other symptoms, their habit and habitat. We can't just say this is a standard painkiller like what we give in allopathy.
They do opt and go for Brufen or maybe Combiflam and all, which they want fast relief. But that is not advisable as far as the other body parts are concerned, for example, kidneys and all. So in that case, I just suggested Gurvel and Tulsi leaves extract to be taken early morning, consume empty stomach and evening. But they said the pain has not reduced as such.
Yeah. See, as I told you, we need to understand the actual cause of this pain, and we can treat it as a common. This thing I can suggest you a simple. I'm just typing it here, which is safe and anyone can take. Any preparation made out of Google. is a painkiller. Any preparation made out of shellaki. So there are so many medicines like shellaki, MR, which are muscle retardant, muscle relaxants. So they are painkillers. But again and again, I'm telling you, it is very important for us to understand the constitution and the condition, and that will give us enough scope to give a exact, nice, right medicine, which will instantly give relief from pain. So I also strongly recommend them to consult a nearest Ayurveda doctor. So, and if you want to have more details, if a particular patient wants to really understand and solve their problem permanently, I can help. I'm just putting the email id, my email id. I will also help, or you can just mail me the specific condition of the patient and any reports and all. I will suggest you some medicines which will definitely help in reducing the pain.
Thank you,
And
sir. Thank you.
yeah, yeah. And let us limit our queries to pranayam today.
Okay.
So, yeah. Yes. So, shall I start? So, I'll just show you what we do, what we teach to our own patients, and like my another answer to Rashmiji is like relaxing the body and doing practice in pranayam also will reduce the pain and increase the prana shakti, and it will heal and reduce the inflammation in various parts of the body. So practicing pranayam is also a good way where a very simple medicine also will act very effectively if we practice the pranayam in a right way. So let's start with the practice of pranayam. Here I am just trying to, I'll show you how I perform pranayam. So as I've told you, this is the chin mudra. It is in my left hand. I'll put it on my left leg like this. And then I will start with, I'll close my right nostril and I will exhale, bring the air out from my left nostril. First, I'll empty my lungs like that. Then I will inhale again. This from inhalation, I'll start counting. Okay. While inhaling, I will just count 5. Okay. Then I'll close both my nostrils. I've counted 10. Then I'm exhaling. I'll count 5. Then again I'll inhale. I'll close both the nostrils. I'll count 10. Then I'll exhale while counting 5. So this is one round. Inhale, hold, exhale, again inhale, hold, exhale. This is one round. We recommend at least 20 rounds on empty stomach. Continuously, if you can practice 20 rounds, that will be a great start. You can start with as simple as possible. If 5 is difficult for you, start with 4 or even 3. While inhaling, count 3. Hold and count 6. Exhale, count 6. Count 3. Again, inhale, count 3. Hold, count 6. Exhale, count 3. It's like 1:2:1 ratio. 1:1. 3:6:3, like that. Very simple. Very, very simple. You need to practice it continuously every day, and within few days you will see that your lung capacity increases. You will be able to breathe in more air. Your lungs can be filled with more air. Then while inhaling, instead of 5, if you can count 6, then hold and count 12. Then exhale while counting 6. Again, inhale while counting 6. Hold while counting 12. Exhale while counting 6. Very simple. Inhale, hold, exhale, inhale, hold, exhale. One round is over. Like that, you can practice 20 rounds. So, if you are increasing slowly, 6, 12, 6, 6, 12, 6, like that, after a few days, 7, 14, 7, 7, 14, 7. Like that, you can increase step by step, step by step, step by step. While you are inhaling, count very slowly, hold and count double the count you are counting while inhaling. Then while you're exhaling, count the same number while you have counted while inhaling. Same 7, 14, 7. Again 7, 14, 7, like that. 8, 16, 8, 9, 18, 9, like that. Till you reach this count of 15, 30, and 15. We call it first level, basic level, where you do only inhale, hold, and exhale. Only Purakam, Kumbhakam, and Rechakam. Inhaling, holding the breath, and exhaling the breath. So 15, 30, 15. It's a very simple way. So if you can reach this, just imagine while you are inhaling, you are counting 15, hold and counting 30, and exhaling, you are counting 15. So it's almost you have counted 60, 60, 60. It's almost 1 minute. And in 1 minute, you are only inhaling and exhaling one time. So you brought down your respiratory rate to 1, just 1. Normally it is 15. Now it is only 1. So imagine what happens when your respiratory rate comes down, becomes very, very, very slow. All the activity which is happening inside, it stops. And it gives enough scope for the body to heal itself. You know, in a tradition, they say, chale vate, chale chittam, nischaletu nischalam. When the air is going inside and coming outside, going inside, coming outside, going inside, coming outside, continuously, mind is flickering. It is like a diya in an open place where there is a lot of air. This lamp is flickering. When you hold the breath, you control your mind. You keep it still. You will keep it still. It will not go here and there. You will be able to have a control over your mind. You'll be able to have control over your thoughts. So this will happen when you start holding the breath. So the holding part is very important. That is called kumbhaka. You hold the breath. So we all can start practicing. So unfortunately, I cannot see your videos, but I'll just make you do this. I will give you specific instructions and I'll count, and I want you to do this. Those people who can switch on their videos, maybe the faculty or panelists, they can switch on if it is possible. Otherwise, just follow my instructions. Keep your back straight. Keep your back straight. Take this mudra, chin mudra, in your left hand and put it on your left thigh. And take this mudra, Vishnu mudra. Take your right thumb, close your right nostril, and exhale. Bring the air out. Empty your lungs. Okay, we'll start now. While inhaling, I'll count 5. You inhale like this. 1, 2, 3, 4, 5. Now close both the nostrils. Close both the nostrils and count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now exhale. Count 5. 1, 2, 3, 4, 5. Again, inhale from the same nostril. 1, 2, 3, 4, 5. Hold the breath for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale for 5. 1, 2, 3, 4, 5. So this is one round. So I'll again count. Please try to do along with me. Okay. I'll just count 5, 10, 5 to one round. Just try to do along with me, and then after doing, if you have any doubts, you please ask. Okay, just first empty your lungs, exhale, then now start counting. While inhaling, count 1, 2, 3, 4, 5. Close your nostrils, close both the nostrils. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. While exhaling, 5. 1, 2, 3, 4, 5. Inhaling, 5. 1, 2, 3, 4, 5. Hold the breath. 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exhale, 5. 1, 2, 3, 4, 5. So this is how you complete one round. Suppose you have block in one nostril. It is common. Most of the people have a deviated nasal septum. So one side air will flow very freely, and other side air might get stuck. It's not flowing so freely. So you might have a difficulty in practicing this, but still you do practice, and slowly the block will get cleared, and then you will be able to practice pranayama on both sides very easily. So if you have any doubts in what I have shown right now, if you have practiced along with me, if you have any doubt, you please ask. And
Though Rashmi ji has already
asked it down.
maybe Tamil Selvi ji, in case you would like to put forward a query.
Yeah, Brindaji is asking, is there any duration? So yeah, as I've told you, you inhale, hold, exhale, again inhale, hold, exhale. That is one round. I'm asking you to do at least 20 rounds. So if it is 5, 10, 5, it will take around 20 minutes. No, if it is 5, 10, 5, it will take just 10 minutes or less than that. Okay.
Tamil Selvi ma'am? Ji, Tamil Selvi ji.
Yes, ma'am. Good evening. Good evening to all. Namaste.
Namaste.
Sir, you explained about the breathing exercise, no?
Yeah.
So is it necessary to hold the breathing for some time, sir? Or only just inhaling, exhaling is alone sufficient?
No, it is not sufficient. Holding the breath is the most important part of pranayama. As I've told you, chalevate chale chittam nischaleta nischalam. When the air is going inside and coming outside, the mind is flickering like a lamp in the breeze. So when you hold the breath, you will be able to regulate your internal organs and also gain control over your mind. This holding the breath is the most important part of pranayama. Inhaling and exhaling, various ways of doing inhaling, exhaling, Anlom Vilom, Bastrika, Kapal Bhati, Brahmari, Shitali, Shitkari, all these things are for preparing our lungs to do better pranayam. They are not actual pranayam, they are initial preparations for pranayam. So in actual pranayam, you hold the breath, and this holding goes forward and it goes into higher levels. And what I am telling you right now is a very, very, very basic level. Holding the breath twice the count of inhaling is a very basic thing. When we go to the second level, we increase the ratio 1:4:2. While you're inhaling, if you count 5, you hold the breath and count 20. And then while you're exhaling, you count 10. double the number of double the count of inhaling. You exhale it very, very slowly, and again you inhale, hold for 4 times what you have inhaled. So this goes, and in next level it goes still up. Okay, so then comes another important part. In the third level we teach shunyaka. Shunyaka is you empty your lungs. You exhale, lungs are empty now.
Yeah.
Then you hold the breath. That is shunyaka. Kumbhaka is like you breathe in and hold the breath. And shunyaka is you breathe out and then hold the breath. That is third level, which is a bit advanced level. But as of now, breathing in, holding and breathing out is very important.
So that is not a kumbhaka, sir.
That is shunyaka. After emptying the lungs, when your lungs are shunya, when they are empty, you are holding the breath. That is called shunyaka.
Okay.
So right now what we are discussing is only simple Puraka, Kumbhaka, Rechka. Inhaling, holding and exhaling. Simple, very simple and very safe to practice.
Okay, sir. Thank you, sir. Thank you.
Nice. Very nice. Maybe if any other participant would like to put forward any other question.
So one more important instruction is, while you are practicing pranayam, you should try to stay relaxed and have a fixed posture. You should not move your body. Some people do like this. While you are inhaling, they do like this. Like that. While exhaling, they do like this. Like that, you should not move your body.
Okay.
While you are practicing pranayam, it's like this only. Only the fingers move. Whole body is still. Relaxed but still.
Okay.
So this is also very important.
Thank you.
Nice. So this has been another interesting and enriching session, as the participants had put forward their interest into knowing what is pranayam and how to rightly practice pranayam. So Bhaiya, this has been our first step. So are we going to continue with the next step and ahead in the coming sessions?
Not immediately. I request all the participants to start, give a try. Just try to practice it for 5 minutes a day. Very, very simple baby steps, whatever you can. If it is only 5, 10, 5, it's okay. Otherwise, 3, 6, 3 is also okay. Some people say that it's very difficult for them to hold the breath. So start with very, very simple baby steps and slowly stretch your limit, and come till 15, 30, 15. And I can assure you, this experience of practicing the pranayama in right way is excellent. I can't just describe in words. You have to feel it. Only, when you experience it, then you will be able to, understand what I am trying to say. And someone is asking, shall we practice while traveling? Is it possible and effective? If there are if there is a lot of ups and downs, and if the road is very, jumpy, maybe that will not be effective. Otherwise, if you are traveling in a train or a flight, it's very safe to practice pranayam in a train or flight. Even a bus, when it is going on a smooth road, that is fine. You can practice. Only a prerequisite is lungs should be allowed to expand. For that, we need an empty stomach, not a full stomach. Immediately after eating, please do not practice pranayam. That is the only prerequisite. Any time is okay for practicing pranayam. And I have seen miracles happening just by practicing pranayam. Just by practicing pranayam, I have seen a lot of regeneration in very, very serious conditions, very tough diseases, getting their body getting healed in a wonderful way by rigorous practice of pranayam. So for all our patients, we make them practice pranayam every day. in our own hospital, where all the inpatients will be gathered and they will practice together. They practice in their home, and we give them targets. You have to complete this level, go to the second level, then go to the third level. Like that, we give them targets, we encourage them, we hold their hand, and we take them forward. But it's not, unfortunately, every day we will nobody will push us to practice pranayam. It's something which is very important but not urgent, so we tend to procrastinate, we tend to postpone this thing. But I request you people to practice it for 1 week, and then if you have any doubts, you ask me in the next week. And next week we will continue with the faculty development program, which the syllabus which you have prepared. So I just want to refresh your memory of holistic human health. So that we will continue next week. And after sufficient practice, if you want me to take you into the second level, where the ratio is 1:4:2, then I will also do that. Antosh Daideji says, I do pranayam every day after hard exercise and Surya Namaskar in the morning. Is it okay? Yeah, it is okay. Only thing is, after doing a lot of exercise, our breath rate tends to be very, very fast. So all we have to do is sit for 2 minutes, take deep breaths, relax your body, relax, observe your breath, observe whether it is shallow or deep. If the breath is shallow, then you make it deep, make it slow. The easiest way to make it deep is hold the breath for some time. Hold the breath for some time, and as much as time you can hold it, and after holding it, then take exhale and slowly inhale, exhale, like that you do. Once the lungs they start breathing in a rhythmatic way, in a relaxed way, then you can start practicing pranayam. That is the only prerequisite. After Surya Namaskar, only generally we do pranayam after Surya Namaskar and exercise of asanas only. So that is recommended. Yeah. So I think we can close this
Nice.
session.
Yes, Bhaiya. So I can see that Tamil ma'am, is there, would you like to know something more?
Actually, good evening again. So actually, I'm also regularly doing all the yoga practices, including pranayama. But sir today told no that holding the breath. So that actually so far I didn't do. But hereafter I will continue with that holding the breath, as you said, sir.
Great. Wonderful.
Nice.
Yeah, thank you.
This is very nice. So, in fact, we all got to know about the real way of practicing pranayama, and maybe many of us were following the regular routine of doing the same, but probably with not much awareness. So therefore, the results were not all that beneficial for us. So it's good that we had this particular session by Sundar Bhaiya today, and many of us got the clarity of how to practice pranayama in the right way. So with this, Bhaiya, we'll thank you a lot, and thank you all the participants for your keen interest in participating, discussing, and equally doing self-exploration on this particular content related to module 2, physical health and related activities. So Bhaiya, with your permission, we'll continue the session on coming Friday, and thank you so much for the input and the content that you shared with us and made us practice as well. That's all the more important.